Hello and good morning. Welcome to Your World Wednesday edition. How you doing? I know we are an hour and 15 minutes late, but we still have a full show lined up for you. And this being Wednesday, it is a Wellness Wednesday, and it being the 22nd of October, we are UKO in the heart of Breast Cancer Awareness Month, and that's the conversation that we are having today. And this year's theme is Every Story is Unique. Every journey matters. And that right there is a reminder that behind every diagnosis, there is a deeply personal story of courage and of healing. And today, when we are having this conversation, we'll be looking at how cancer care has transitioned from just surgery, chemotherapy, and now it's embracing mindfulness, it's embracing movement, it's embracing emotional recovery. So like the topic today says, science, surgery, and the soul. That is what we're focusing on today, the evolving face of cancer treatment. But even before I introduce my very powerful panel, I want to let you know what the question of the day is today. And the question is, if you could change one thing about breast cancer treatment, what would it be and why? If you could change one thing about breast cancer treatment, what would it be and why? Indulge us with your answer, your thoughts. NTV Kenya on all of our social media platforms. We'll be looking at your feedback as the show goes on. Our lines are open, WhatsApp line as well. Please, tupigie simu, uliza maswali, because I promise you, the best of the best are in studio today, okay? So that's the question of the day right there on your screen, and let us know what you think and what your answer is. But it's time for me to introduce my very powerful panel, and I will say, Winnie's not here, so I'm just gonna do this on her behalf. We'll start from my immediate left, okay? From my immediate left, we have Elizabeth Mutunga, Wamusi, breast cancer survivor. Welcome. Welcome to the show. And I know you were dissing me, saying, oh, I'm wearing colors, and but I'm representing. I'm all right. And right next to Elizabeth, we have Shahzad Karim, who's also a breast cancer survivor. Welcome to the show.
Thank you.
And you told me something very interesting as you were coming in today. That you, when did you come to this building for the first time?
1994.
1994.
I worked in this building all the way till 2013, and then I shifted to Mombasa Road. So I'm very much part
You're
of
home.
this.
You're home. You're home. You should tell me Karibu. Yes. Karibu Nation Media. All right. And right next to Shahzad, we have Munira Rahimtullah, who's a wellness and movement coach. Lovely to have you.
Thank you.
Yeah. Are you okay with the red on red?
Oh,
perfect.
completely.
Okay, and moving on to the gent and the ladies behind, starting still on my left, we have Dr. Eric Hungu, who's a general and breast surgeon. Lovely to have you. How are you feeling? You know, have you seen how we over here, ladies looking all gorgeous?
Ladies are looking amazing.
Amazing, right? Okay, and right next to Dr. Eric Hungu, we have Dr. Sarah Nyakiongora, who's a consultant, plastic reconstructive and aesthetic surgeon. I said everything together correctly.
Perfectly.
Karibu sana. Lovely to have you. And the one who got memos right, we aligned somehow. We have Dr. Tracy Irura, consultant clinical oncologist. Lovely to have you on the show. Karibuni sana. And I feel like we're late to the party as Your World, but better late than never. And I'm happy that we're having a wholesome conversation today. And it's not just about what is cancer, where we are, because we've had those conversations, but when it comes to the care, the treatment, things have shifted over time, and I think it's important for us to understand where we are, where we've come from, and what is available now when it comes to even the recovery bit of things. So I think probably the best place to start this conversation is from Elizabeth. Was I supposed to?
The ones who went before.
The one who... Shahzad, are you okay to start? Maybe we can just start with your story when you first got diagnosed. What was that like for you, and how did that even happen? Because we've had all kinds of horror stories on how that message is delivered, how you find out. How was yours?
So I got diagnosed in early January 21 because of my daughter. you know when they say a daughter is an angel in your life, your best friend, true to speak, she was.
Yeah.
She had come down in the COVID time. She was working in Canada. She got a break and she was having mental health issues of isolation there. She came down in October 2020 to see my mother, who was at that time going through 4th stage breast cancer treatment. She worked till December, and I said, you know, before you go back, you need to get all your tests done, see the doctor, see the gynecologist. So she asked, and when did you do yours last? I'm like, June 2018. She goes,
wait, 2021?
Yeah, we were in December 2020. I said, but I have time, I'll do it, don't worry. She goes, nope, we're doing it together. So that's how I found out. And when I found out, it was very traumatic for me.
Yeah.
I would want to stop there, but it was very traumatic. And I was like, oh my God, I, Shazad Karim, have cancer, breast cancer. How am I going to accept this? It's the end. How am I going to share this?
Yeah.
Yeah.
Okay.
That was the first feeling.
And I'm imagining breaking this news, because it's one thing to receive it, but then you don't leave alone. You have a community of people. You have your daughter, your mom, who's also going through treatment at the time. So that must have been quite...
It was.
It was quite heavy.
It was.
Okay.
I remember going for my biopsy alone.
Yeah.
I didn't want to tell my daughter and my husband. And we were going out for dinner that night because I know my daughter was leaving for Canada, and I couldn't raise my left hand because a biopsy had just been done on that afternoon.
And they did not know?
I didn't want to tell them because I was not accepting it myself. Okay. I was in pain, but I went for dinner and was using the fork and knife with the right hand alone, just struggling in silence, you know?
Yeah.
Yeah.
And how was it breaking? How long did it take before you had to tell
Because I now had to start treatment. Okay. Within a span of 2 weeks or so, I braced myself and started the conversation.
Okay.
And then regretted not having started it earlier anyways. Yeah.
Okay. Elizabeth, how was it for you? Tumefika eventually. Yeah.
So for me, what was very interesting is that during COVID, I got COVID, and I was in ICU for 2 months. So I thought I had gone through the worst because I had been in hospital for so long. 95% of my lungs had been eaten up by COVID. And so I was just starting to breathe on my own 2021. So in 2022, my anxiety levels and depression because of having gone through lockdown and being isolated, I think now that's when they were presenting. So I took a break and left the country, came back, and when one of the days I felt a lump, then I'm like, no, it can't be a lump. And I felt this other side, feels like a bone. I was like, no. So after some time, I started feeling pain under my armpit. So that time my daughter was around 16 and she says, Mom, your lymph nodes are having a problem. I'm like, how did you know this? You're still a baby. What are you talking about? And so I go in also again alone first I went for a mammogram, showed suspicious. Then I went for a biopsy, again alone. I think sometimes being strong people sometimes is not good because you do things alone. Yeah. And I think because I'd survived COVID, I was like, hey, this one. So when I got the results, I was a bit shaken, but I was like, I survived COVID, and so this one I'm going to wing through. But what I didn't know was the journey ahead, how it was going to look like. So that, for me, that's how I found out. And then I met the doctors who worked with me. Yeah.
Okay. And so you're walking this journey alone. What happens to the rest? At what point do you open up?
So it doesn't help that my sister is in the medical field. So anytime I would go for tests, she'd be like, you can ask Dr. Hongo here. I want to be on the call. So she would insist she has to be on the call with Dr. Hongo and the other doctors. So my sister actually is the one who broke the news to my family, my mother and my brother. My children, because we had gone through COVID, they were still struggling to first accept COVID, and then now here is cancer within 2 years. So it was quite hard. For my daughter, it's still been very hard because she went into lockdown. So, and then my son is not here, so he's getting all this information. So when I'm talking to them, I have to put this big smile that I am okay, so that they are okay. I think my husband went into shock also. I think he remembered what I went through COVID, and then he was like, what's going on? I remember him saying one time, we're in the book of Job in this family because there was just too much coming on. So finally, I told them, and then there was, of course, awkward silence initially because they're like, how do we go on from here?
There's something that has come up, and I'll rope you into this, Dr. Hongo. When Zad was talking, and she said how it'd been a while since she'd gone in for a gyno check, you know, and she's there defending herself, saying, "I'm fine, you go." And then you touching, feeling it's a bone. I'm not so sure what's happening over here. But, you know, like it takes something else out of ourselves to get into the space where we are checking and following up to know how we are. And I don't know, what can we do? If someone is tuning in for the first time, what are probably some of the things they need to look out for? And how do we self-check ourselves or self-examine to understand or know something is off?
Okay, so they've actually covered two important aspects of early diagnosis and screening.
Dr. Hongo Pole, even as you answer that question, please introduce yourself as well, like exactly what you do, because I know we've got different
doctors at the back.
Yes. It's not all of us do the same thing. No. So yeah.
Okay. So I am a breast surgeon. I started off as a general surgeon, then I went and did a specialty fellowship in breast surgery.
Okay.
So now I'm a breast surgeon. So now talking about early detection, screening, diagnosis. So she got her last mammogram in 2018, then now again in 2021. So we talk about annual checkups, annual screening mammograms. So you don't have to feel something, you don't have to see anything is out of place. Just go for your annual checkup.
Okay.
And that's why it's important we have these October campaigns, because now a lot of people now are prompted to go to hospital in October for the mammogram.
Okay.
The other thing we encourage people is the self-breast examination, which is now what Elizabeth did, and she felt a lump. So the whole point of self-breast examination is not to make a diagnosis, is to know something is different in your breast. So you need to know what's normal for you, so that if anything changes, you're like, that doesn't feel how it normally feels, then that prompts you to go for a checkup. Even if it's not a screening checkup, you might have gone for your screening mammogram in October, you feel something in March. Don't wait for October. If you feel something, go to hospital immediately. Go get a checkup. But having said that, by the time we start feeling something, it means that the tumor has already been there for a bit of time. So the things we are talking about now is that lump. And the lumps are usually painless. They might be of varying sizes. Some people are more keen. They might notice it when it's still small. And they come to the hospital. Even the doctor is not sure whether they feel a lump. But you're convinced it's not been like that. So that at least will prompt their checkup. We talk about skin changes. It might look like an orange peel. We call it a pod orange appearance. Sometimes you get nipple retraction. Sometimes you might just find that the breast is looking smaller and it's looking fixed to the chest wall. But those are usually pretty sort of advanced signs of presentation. That's why we try to encourage people to go for annual checkup.
Okay. I think that answers the question. We just need to get checked, because I went to hospital last month, usual checkup, and then they asked me if I've done a mammogram. And I said, well, it's been a while, guys. Like, have you self-examined? I said, it just feels like there are many things going on in there. I don't know what is wrong, what is not wrong. It's like, the thing is, if you keep doing it often, then you will know when something is off. So yeah, it's one of those, because most people will be like, it just feels like there are tissues and muscles and everything happening in there. Dr. Sarah, I think probably let's start with the introduction of what exactly you do and how it plays a role in all of this.
Okay, so my name is Dr. Sarah Nyakiongora. I'm a consultant, plastic reconstructive and aesthetic surgeon. And basically, when we talk about management for breast cancer, comprehensive breast cancer management has to include breast reconstruction. So breast reconstruction is basically just a surgical procedure that shapes a breast or a form of a breast after mastectomy has been done. I think Dr. Hongo will talk about what mastectomy is. This is most of the times the mainstay for surgical management of breast cancer is removing the breast. So we come in to recreate that breast so that when a patient wears clothes, someone is not able to tell that they went through breast cancer management. Yes.
Okay. It's back, I promise you. Kindly introduce yourself and also let us know what exactly you do.
My name is Dr. Tracy Irura.
Yes.
I am a consultant clinical oncologist.
Yes.
So after we do the main pillars of treatment, which is surgery, you come to me now for radiotherapy, systemic therapy, target therapy. We also nowadays incorporate a lot of supportive care and palliative care. So this is exactly what I do.
Aha, okay. And then we've got movement. And I think it's something that probably is, I don't know, probably on my end, something new, fresh, and, you know, probably a lot of questions around that and how that probably plays a role when you're talking about cancer care.
Okay, so my name is Munira Rahmatullah, and I'm a wellness and movement coach. And I specialize with chair yoga, so not yoga on the floor, but sitting on the chair. I do breath work with meditations and also EFT. So EFT is called Emotional Freedom Technique. And it is a self-healing technique that you use by tapping on certain meridian points on your body. And I'll show you the points.
Okay.
So what we're doing is we're tapping the meridian points, which are energy channels, which signal your brain to help reduce the stress hormone.
Okay.
Having said that, I feel that in cancer care, of course, chemotherapy, radiotherapy, surgical procedures, like our doctor friends have said,
Yes.
is essential, is a must. There's no compromise in that. But this alternative practices will help, will support the patient, the survivor, in helping them to reduce their stress levels. So we have to even understand that cancer just doesn't affect the body. It goes beyond.
Yeah.
It touches the mind,
Yes.
the emotions, and the spirit. So I work holistically, not just looking at the disease, but looking at the whole person.
Yeah.
So with chair yoga, we're looking at the physical part, helping the stiffness, the soreness after surgical procedures or after any procedure. Breath work to help reduce anxiety, helping the oxygen flow better.
Okay.
Breathing in and out, deep inhaling and exhaling. And with EFT, we're working on the emotions of fear, overwhelm, shock. Anxiety,
Yeah.
yes. Just helping you to connect with your body, with your soul,
Yeah.
and helping you to go through this journey with a little bit of dignity, acceptance, and love. Yeah.
I have an interesting question, and probably
Sure.
this, me and many other Kenyans, why sitting yoga? It feels like when we're on the mat and stretching and all of that, like it goes everywhere. But why particularly do we
Chair
focus?
yoga?
Yes, why the
Yeah.
chair?
So chair yoga is especially for people who have limited mobility, for people who are weak,
Fantastic.
who cannot
Okay.
actually sit with their legs down on the floor.
Great.
There is the alternate of a chair yoga, and you're still doing similar stretches to
Yeah.
what you would do on the floor, but you're using the chair as a support.
Okay.
Right? And this will help reduce the stiffness and the soreness, and very gentle, light movements, which you can use on a chair.
Okay.
So yoga is a form of exercise, and mentally also it will help. Emotionally it helps because I incorporate meditation and breath work with the chair yoga. Yeah.
And this can help anybody else as well.
Yes,
So I'm
yes.
looking forward to that session, which we'll have
Yes.
on the show.
Okay.
And we've talked about probably different kinds of the different kinds of probably treatments that are there. And I know we've not gotten to probably the mastectomy, lympectomy. I'm not so sure I'm saying it right. But when you got diagnosed, what kind of treatments were available for you, and how did you get to choose what was right? Was there direction, consultation? Was there someone who was walking this journey with you?
So first, I was just turning 60 a month later.
Aha.
So when I found out and the treatment options were before me. I said, you guys got to hold on because I got to go finish my 60th birthday and then I'll be right back. So that's how the journey. Yeah, I did exactly that. I said, hold on.
Okay.
And I'm coming back.
Yes.
Then there were options played before me. It's either the chemo, lumpectomy, radiation,
Yeah.
or if I chose a mastectomy, well, either of the two. So finished my birthday party with my friends. I came back and then I was told I needed to have an MRI. So I did an MRI. When I did an MRI, I found out that aside from the lump, which was deep inside the breast, there were some specks, tiny specks that were not cancerous, but could become cancerous. So 2 days before my mastectomy, I decided I'm going for a mastectomy.
Okay.
I changed my mindset from the previous route to this.
Yeah.
And that's how I started the journey, the mastectomy. But I want to take you back to what she said, and just in terms of the discussions and, you know, making sure that you diagnose early. About 9 months or 10 months before I got diagnosed, I was actually suffering from inside pain on the left breast going through the underarm and the hand, and I could never place it because my lump was very deep inside, so I couldn't see it. Although I was not very particularly efficient about checking all the time, but I couldn't really feel it. So it was deep inside. But I was having this constant dull pain that I couldn't put my arm or head or mind to, and I didn't understand.
Okay.
Over and above that, my heart and my soul was extremely sad. I have never said this to anybody. Extremely sad. And that's when I met Munira before I got diagnosed. We were just talking about, you know, good healing practices, and, you know, she had started going into EFT herself, and then she became a practitioner. You know, when we say we need to run our steps for our body, and we need to run our emotional steps. We need to run our movement steps.
Yeah.
We need to run our breath steps.
Yeah.
It's not only movement. It's not physical, but there's much more that goes to it. Post-cancer, I can close today to say I'm extremely, extremely grateful to cancer. I love it. I'm grateful. What it has taught me after that, which I will share with you a little later, amazing. But you have to go through the journey. No pain, no gain. It was pain for sure, but it was gain at the end.
Okay.
But, so that's how I chose the mastectomy. Coming back to your original question.
I think it's a beautiful thing that you shared that with us as well, because now it ties into that conversation as well, to just understand what it does, and that we look at things on the physical sense of, like, this is just what I'm dealing with, and this, it's a one direction road, but then not necessarily. How was it for you, Elizabeth? I can see you knew
because
you knew. Yes.
I thought I was crazy.
Yeah.
But for me also, when I was told about the diagnosis, I was going for my graduation. So if I told everybody I'm going first for my graduation, flew to Scotland, graduated, then came back. So January, my sister had come because she had a relative who, her father-in-law was not well. So she introduced me to the oncologist. And I was very angry because she was really pushing me. And I think earlier on, I had seen my two stepsisters go through cancer, and what I'd seen was not good. So to imagine that I might go through that, I was I was upset initially. So she takes me to the doctor. I think the doctor looked at me and just thought, this one is a skiver. She will run away. And I remember him telling me, I know where you live, I'll come for you. And I'm thinking, really? You'll come for me? He threatened me. And so, but I think I needed that.
Yeah.
And then after that now, so I had earlier been sent to another breast surgeon who was, bedside manners was zero. I'm sorry to say that. So he said, I was turning 50. So he says, you're turning 50, you don't need that breast, we'll just cut it and everything. And I'm thinking, okay, wait a minute. While I'm under, what else can he do? He could just remove something. So I was like, no, I'm not going to this guy. So when I went to see the oncologist, I asked him, do you know this doctor? He said, well, I only know Top Notch. He's an interesting doctor. I know only Top Notch surgeons. So I told him, okay, on your list of Top Notch, send me to one.
Point me in the direction.
So he sends me to this guy. So because I'd had a very bad experience, I remember walking into his office and I was still holding my handbag and I was waiting for him to say something wrong. And I was going to walk out. Because the other one I sat through all the nastiness. This one had said, he starts, I am so gone. So I'm holding on to my handbag. So he says, hi, welcome. I'm thinking, we've just started. So actually, after he said, please tell me about yourself, that's when I looked at him, because I was really waiting. He said something and I go.
Yeah.
And I remember we had a very long conversation about, is it mastectomy, is it a lumpectomy? And I'm like, no, just remove the lumps. Then later is when we realized I had like 5 others inside the skin, what she was talking about, that you couldn't feel. But the one I could feel was the only one that was top here. The others were inside the skin.
Yes.
And so my sister also being, like I said, in the medic, the calls we had, I'm so sorry, but the calls we had, my sister was very pushy, and she was like, no, you're having a mastectomy.
Yeah.
And I think that is when I decided on the mastectomy. But of course, Shingo Upande, I was not very excited about it. But I'm glad I did that, because unfortunately I lost a friend who decided to do lumpectomy.
Yeah.
And within a very short time, it had moved to something else. So, yeah.
So then how do you decide with the patients? How do you choose with this patient a lumpectomy would do, with this other one a mastectomy would do?
So we need to get that initial imaging. So it's usually the mammogram.
Okay.
The mammogram tells us where the areas of abnormality in the breast are. And then we do the biopsy, then we get a tissue diagnosis. And then now we can talk about treatment options. So of course, like she said, treatment options could either be a mastectomy or a lumpectomy, what we call a breast conservation surgery.
Yes.
But if then the decision is to go for a breast conservation surgery or a lumpectomy, then you need to be absolutely certain there is no other focus of disease in that breast. That's why sometimes we ask for an MRI. She was told to do an MRI because it might pick up some things that might not be obvious on a mammogram or an ultrasound. So if we find that there are other foci of disease and they're in different, so we divide the breast into quadrants.
Yeah.
So you find maybe the different foci of disease are in the same quadrant, then you can remove that quadrant and you can do some reconstruction here with Dr. Sarah. But if they're in different quadrants, then it's not possible to do that lumpectomy. You must do a mastectomy. But then now you can make a decision. If we want a nice cosmetic outcome, then we can do a reconstruction, which is why Dr. Sarah was saying that's the importance of having a multidisciplinary team, because it's not a one-man show.
No, it's not.
Yeah.
No, clearly, if we're going with Elizabeth's experience, I could see all the doctors behind there cringing, wondering, oh, you're Niwawangi. Dr. Tracy, I'm going to rope you into this one and maybe talk about the different kinds of treatments that are there and how personalized they can get depending, moving from one patient to another.
Yeah, so now we have moved from one size of treatment fits all to precision medicine.
Yeah.
So now what we really look at is, first of all, you ask your patient or you discuss what are the goals of care. Okay, when we start the treatment, we ask what are the goals? What are you trying to achieve? Are we trying to cure? Are we trying to stop pain? What are we trying to achieve? So goals of care is quite important. Then the patient, how is the patient? Is the patient fit for the treatments that we need to give? Is the patient eager to get the treatment? What do they want for themselves? So nowadays, we actually rope in the patient. Even in our MDTs, we actually ask patients to join in so that they can hear what we're discussing and so that they can be comfortable with the choices that we make in terms of treatment. But the most interesting thing that we have now is tumor biology. Breast cancer is not one disease. Breast cancer has so many other facets in terms of tumor biology. And that's why after the biopsy, now we come back and discuss with the surgeons, can this patient actually have surgery, or do we need to start with some sort of chemotherapy or maybe even target therapy, immunotherapy, to kind of shrink that tumor so that the surgery outcomes are a bit better. So tumor biology is key, and this is where precision comes in.
Okay. So there's, I'm sure we've probably seen people who've gone through maybe chemo, radiation, and sometimes their quality of life can sort of shift. It becomes heavy, there's hair loss, there's many different things for different people. Is there a way to probably sort of find a balance for that, to just make sure probably the treatment does not affect their quality of life? Have we gotten to that point now?
Now, with The treatments we give also stage, depending on the stage that we find the patient. Then we decide which treatment. So the good news is we have a lot of what we call target therapy, immunotherapy. The side effect profile is a bit better than the traditional chemotherapy. The problem is now these new therapies are a bit more expensive, so the affordability becomes a challenge. But if we discuss and sit with the patient and you discuss the different side effects, the patient is aware of the side effects. I feel like they tolerate them a bit better because they know what they are getting into. And then even for radiotherapy, now we have newer machines that can do more precise kind of radiotherapy, like IMRT, SRS, SBRT. So these are better modalities that we avoid the organs at risk and just try and target the area that we need to radiate. So I feel that the future is nice. It's better. We can see better outcomes in terms of the toxicity profile is what we're trying to reduce. And every year, I can assure you, there's a new modality of treatment coming out. So the most important thing for a patient is just to sit down and discuss with your doctor all the options on the table. Then you can come up with a good pathway that is specialized just for you as a patient.
Okay. And so this, Dr. Sarah, this will probably happen before they come to you, right? Or
yes.
Right.
That's a very good question. For a very good point. Because it's actually very important for all of us to sit together in the beginning and start planning for the breast reconstruction.
So I need to know from the onset if it's an option for me.
Exactly.
So if I come to this first meeting and I say I am comfortable in my skin, if I don't think I will need that, I will be okay to just carry on with my life with or without the breast, that's still okay?
That is okay.
Okay.
In fact, what we normally say for us, success in breast reconstruction is offering all our patients breast reconstruction. It's just the offering. Telling the patient that this is an option. We have succeeded. The patient sometimes, some of them do not want to have a reconstruction done. They're okay having an aesthetic closure, aesthetic mastectomy closure, and they don't want anything else. But as long as that is an option that has been presented to them, I really feel sad that your first consultation, you were just told, it's okay, you can do without a breast. I mean, so we, in terms of awareness is not only to our patients, it's even to our clinicians, and that's why we love working with Dr. Hungu, who's a breast surgeon, because he will tell every patient that breast reconstruction is an option.
It's an option.
Dr. Tracy, as well as an oncologist, even as we are planning for the reconstruction for the patient, she always keeps that in mind. Because there are things like the radiotherapy and the immunotherapy, you have to time. The timing will change based on what? The timing for the reconstruction will change based on what kind of treatment they're having.
Okay.
Yeah, so it's important to plan from the beginning.
From the beginning. But what does the recovery look like?
For the breast reconstruction?
Yes.
So I'll go back to, in terms of timing, you can either do an immediate breast reconstruction, meaning at the same time that Dr. Hungu is is doing the mastectomy, we are able to reconstruct immediately. So that patient, if they're to undergo radiotherapy or chemotherapy post the reconstruction, they'd have to wait. They have a waiting period. Heal completely, then do the rest of the treatment after. What I normally tell my patients is to give themselves 4 weeks before going back to full function, but it varies. Some patients in 2 weeks, the next clinic after operation, they're up and about, and it also depends on the kind of reconstruction you did. You can use the patient's own body tissues, which is called an autologous reconstruction, but sometimes you can also use an implant, which is also called alloplastic. Obviously, with the implants, the healing is much faster, but then you're not able to do radiotherapy after that, or the chances of getting complications with radiotherapy are much higher. When you use the patient's own tissues, this is the preferred for most of our population, the recovery will be longer because now they have 2 surgical sites where the mastectomy was done and then where the flap, we call it a flap. So skin, subcutaneous tissue, sometimes a muscle that is just redirected to the chest wall to recreate that shape of a breast. That healing might take a bit longer.
Okay. So, Munira, as I'm going through this treatment, I've been diagnosed, I have my panel. The panel is here telling me what to do and how to go about it. Do I start at the beginning with you from the onset, and what's the importance of that? And also, even as you answer that, how's the uptake? How are people responding to this kind of cancer care?
So it's the individual's decision of when he or she wants to start. When she wants to start.
Yeah.
You know, right from the onset, or come right in the middle of the, you know, when the treatment or the journey is going on. And depending on what the individual wants. So I normally come to the level where she is. I go to the emotion where she is.
Yeah.
And very calmly, we start with breath work first. You know, and I give reassurance that this is a supportive therapy, and with your medical treatment, this will help you emotionally and mentally, and with lots of deep breath works. And then usually with deep breath works, which is really a miracle, honestly, the inhale and exhale just helps you to calm your nervous system.
How powerful that is.
It is.
Yeah.
People don't really know it.
And it's free.
But yes, it's free, you know, and in abundance.
Yeah.
It's in abundance.
Yes.
So if we can try and connect with our breath, and we help calm the nervous system, anxiety and all those emotions that one person is feeling, they're able to reduce that, then the movement naturally flows, right?
Okay.
And usually I try and do it in an open space where there is fresh air. So you're doing gentle chair yoga exercises. And especially after a procedure, you know, usually they feel the body is foreign. You know, I would like them to connect with their body again. It's just connecting to your soul and body and mind.
Yeah.
And I have had patients and survivors who have liked this to say, you know what, I want to come back again. I want to come back. I felt good after this. I feel like a breath of fresh air. Something that I have been thinking so much, and anxiety, but I left that space and I've come to this space which is just nurturing me now.
Yeah.
Yes. So I think it's being accepted slowly.
Yes.
And I really hope and pray that people do accept this supportive therapy whilst they're doing this, because it really does make a difference.
Yeah.
Like Shahzad said, we have to do our emotional steps, and you have to release emotionally in order. So you need to prepare yourself from within to accept the outside, right?
Yeah.
And what are we saying? We're just saying, embrace it. Embrace it, accept it, acknowledge it, and flow with the journey rather than fight it. It just makes it easier that way. That's all, yeah.
Okay. Shahzad, you talked about how you've learned quite a bit. Your life, the quality of life is better, but you have to take the journey. So that means it wasn't an easy journey to take, and still at it, talking about it, reliving moments of it. But when you look back, what are some of the fears that you had, or probably some misconceptions? We are all saying everything and anything about things we do not know until we find ourselves in a space where we really need to understand what is the truth, what is a myth, what do we believe in, and what don't we believe in. But what are some of the fears that you probably had while you were going through this treatment?
So before the treatment, when I decided my option, let me tell you, I was placed before what they call a committee, but it's actually a tumor board. You're like sitting in a boardroom.
It's a boardroom.
There's a radiologist, there's an oncologist, you know, all types of professionals. They're telling you what are the options. And when I finally decided my option, so be it. When I came out, let me tell you first, when I went in for the surgery, and when they came to pick me to go to the theater, the surgeon came, and you know, the guy who pushes the nurse was there. So they brought in a wheelchair. So I looked at them. I said, "Who is that for?" He says, "I said, I'm not crippled. Going for a breast surgery. I can walk." So there was a negotiation I had to go through, because you're not apparently in the hospital allowed to walk to the theater, because some people run away. I said, "I will not run away. I will go with you. We'll go to the theater together. Please." There was a negotiation for 10 minutes.
10?
Then the surgeon said, "Okay." I said, "I promise. I'll walk with you. That's how I went to the theater. I was not going to go in a wheelchair just because I was having a breast surgery. Come on, man.
No.
Okay, so I went. When I went into the surgery, when I saw everybody on the beds, and I went in happy, smiling at them, I said, okay, I better calm down. I'm going in for a surgery. I better be serious about this. I went in for the surgery. When I came out, and then the journey started. When I came out of the surgery, for the 2 or 3 days I was in the hospital, of course I had pipes hanging around me for 2 weeks because the fluid was draining. But I went into blister mode because the tapes that they put around your skin reacted. So I came out of the hospital in a lot of discomfort, no problem. 2 weeks later, I said, I'm going back to work. I will heal at work and I'll go on, because I was not going to. I lived a normal life, and I tell you, I worked harder than before. So I went back to work. Within a week of my going back to work, my husband decides to have a heart attack. So he has a heart attack. My daughter, thank God for her. I keep telling you she was my angel and still is. She decided to stay back a year back and work from here and look after her, at least give me the support. She rushed him to emergency and I rushed from work, which was on Mombasa Road. And then he went into a surgery to replace some stents. 1 in a million chance that one of his stents frayed. So he was in serious pain, and we could all not decide, stents are a breeze. What the hell is going on here? But he went through it. He went in for the surgery at 5. He came out at 2. Morphine, nothing would help his pain till he just passed out. So I was on my feet from work in the morning to getting to home at 3 a.m. in the morning. This is barely 2 weeks after I started work. My wounds were still healing. No problem. April came. I went for my first chemo thinking, it can't be that bad. When I came out of the chemo, it was a 360 turn in my whole personality. Yeah. I came out from bright to totally down, sad, tired, fatigued. Brain couldn't understand what was going on. I'm like, oh my God. Within a day, I'd become dehydrated. I was nauseated. They had to put me on a drip. Constipation. I couldn't eat. Survived. 1 week later, you forget it because it's a 1 week space, and then you're back to normal. I continued to work. I was not really going physically to work because of immunity, and COVID was rampant that year. So I worked very hard actually, but I worked. Less than a week later, my mother was sick. She was, remember, recovering from breast cancer because she had done a radiation and she was on hormone therapy and she was recovering well, but she had her kidneys were giving way. So we had to admit her to the hospital. Within 5 days, she passed away. And you know, when I, for the 1 week after my first chemo, I was going to work, she would call me, why are you not going to work? So I said, Mom, when I used to be sick before, you used to tell me, stay at home and rest. Yes. I'm the type of personality, even if I'm dying, I'll be there for you because I must keep my duty psychologically. Yeah. So she passed away. She passed away a day before my son's birthday. My son and her were very close. The day I went for her funeral, my hair was shedding. So at the funeral, I was sitting, I said, what is this? Oh my God. Within 3 days after the funeral, I put on a bright pink lipstick and I went to shave my hair. I had to make it an occasion. I had to look bright. I took a picture of it and I said, okay, shave the hair. I looked at myself. I said, I have to cope with this now. No problem. Then I was given a wig to wear. I said, I can't handle this. This is giving me stress. Took off the wig. I went to chemo caps. I lost my eyebrows. I lost my eyelashes. I lost everything, but I persevered. My husband got COVID. He went on with it. Came October. He had a second heart attack. Went on with it. Then he got COVID again in December. Then I got COVID. Now remember, in life, we're all networking with family, with work colleagues, with everybody.
Yes.
This time I was networking seriously with God. For that whole year, I was chatting with God. I'm like, Lisa, you got to help me, man. But December 21, end of December, I went to him. I said, now God, you listen to me. I listen to you. I network with you. You gave me gratitude. You gave me forgiveness. You helped me through it. But now you listen to me. I've done everything you wanted in 21. 22? No more. It's my turn now. You network with me now. But those were the journey steps. And the fear of losing the hair was there. my eyelashes, my eyebrows. I became dark. Of course, I lost weight because I couldn't eat much. There was all that, and I was dealing with it. Remember, I was also dealing with my own perception of how I looked without one breast and with one breast. Because I had not gone for reconstruction, because they were saying after the journey they will decide whether I still need radiation or it's okay.
Shazad, just hold right there, right there. It breaks my heart to do this, but we have to pay our bills quickly. And we will be right back. This is Your World Wednesday edition. Don't go too far. Welcome back to Wellness Wednesday on Your World. I'm your host, Mikali Mary, and today we are focusing on breast cancer. It's science, surgery, and soul. All of that put together. What does the cancer care look like now? Where were we at? What are the possible options for you here and now? And just before the break, we were, Shazad, I'm so sorry, I have apologized even during the break, because you were at the height of, we were right there talking about the fears and what you were going through, the fear of losing your hair, losing your eyebrows, lashes as well. You lost your weight as well. That I think that is where I cut you short.
No, it's okay. The fears were very prevalent.
I
had to deal with all forms of rejection at looking at myself. Like I said, I turned dark, no eyelashes, no hair. My nails were brittle. My nails had gone dark. There was a lot going on that I had to deal with. But every time I was going through that, I was rewiring with all these emotional therapies that were helping me go in terms of confidence, in terms of, being positive about it, in terms of fighting the battle and saying, this is just a normal disease. You know, everybody has cancer as a stigma. It's really not a stigma. There's nothing wrong with cancer, nothing wrong with kidney disease, nothing wrong with hypertension. It is what it is. It's a natural disease, meaning discomfort of the body. You deal with it and you move on. And so when this emotional stuff comes in, I had another doctor, if I can mention her in absentia, Dr. Ruchi. She also taught me a lot of emotional techniques. But when she shows you our EFT, which is emotional freedom techniques work, they do, because your brain is absorbing a positive aspect of how to deal with it. But the journey is for real. I'm sure when she shares her journey, she'll tell you. It's a journey of being like persevering and coping with it, and then dealing with it, and then getting out with it and telling everybody I did it. And now I'll show you what more I can do. And I did it. I became very free-spirited after that, and I'll tell you more about it.
Okay. Elizabeth, just before we get into the feedback on our WhatsApp, maybe you can just share some of the fears that you had and, going through the process, understanding what is available for you, making those choices, even with your very powerful panel of doctors who are helping you probably with these decisions.
So initially, when I was going in for theatre, you know how you believe as a Christian, maybe by the time you're going in, somehow the lump will disappear and you don't have to go through surgery.
You're praying about it.
So you're praying about it. And so when she was talking about, now I know why they brought me the wheelchair. I didn't know why they brought me the wheelchair. But you remember, I'd already been told I would run away. So they had that faint idea I would. Anyway, so I'm taken into theatre. And I remember Dr. Hungo telling me, now all you need to do is pray and sleep, and then I told them, okay, we'll meet you on the other side. And I think for me, I didn't know I was in theater for 12 hours, because for me, they did the reconstructive surgery. So they removed skin. I was given a tummy tuck without asking for it.
Excuse me.
And so that's how they reconstructed the breast. But so like you're saying, you have all these tubes hanging everywhere, and you're trying to figure yourself out first, trying to understand what's going on here. And then I come out of it and I go home and I'm thinking, I can still do it. I remember one day calling Dr. Hungo, and I was in so much pain because the fluids had accumulated and I was feeling like I'm dying. And so I'm calling him on a Sunday and he's not picking, but finally he picked. So I had to go for surgery, what was it? Draining. So then you're not told, okay, you have an idea, but you don't know how bad it will turn out. Then now you start chemo, and you're thinking, okay, I'll breeze it. And I remember my oncologist telling me, now chemo is not as bad, because like I told you, I had two sisters who'd gone through chemo and radio, and so I would see how they would vomit and be sick, and I'm like, I'm not going to look. If I survived COVID, I'm not going to go through this. So one thing I'm grateful for, the medications I was put on, I never threw up. I would go to hospital. For me, I used to call Wednesdays my mission field. So for me, I used to go to hospital to hug others and to encourage them. Of course, you're going through your drips.
Yeah.
But like you're saying, of course, you lose your hair. You lose, like my nails are still black. You don't have eyelashes. You don't have eyebrows. And you're looking at yourself in the mirror and you're thinking, there's one day I was walking out. I think I was wearing a very long skirt and, of course, with my headband. And this lady just stopped me and asked me, Madam, nothing I'll buy or anything, but which church do you belong to? And I'm looking at her and I'm thinking, what do you mean? No, you're dressing and the headband. I said, it's a church where people do not have hair.
Oh, you did what?
She thought I belonged to a sect.
Yeah.
So that is why I'm dressing up like this with my headband all the time. The church where people do not have hair. So you have to make jokes out of it. Otherwise, you'll be depressed.
Yes.
So you make every opportunity that presents itself. Of course, it's not an easy journey, but you're not going to die there. You're out. There's a reason you went through it, and then you come out here and then support others.
Yes.
Yeah.
And you talked about reconstructive surgery, and Dr. Sarah had mentioned it before and told us what the aftercare looks like.
Yes.
How was it for you?
So it took a bit of time to heal, but of course for me we also didn't start chemo immediately.
Okay.
I first had to heal, and then after that, that's not when I went back. I went for chemo. So it took a bit of time. Of course, the wounds don't heal as fast as you'd expect them to heal. So you have to sleep in certain positions, making sure that you don't get hurt. And it was a journey. But for me, I felt like chemo was harder.
Yeah.
Chemo was harder.
Okay.
I think that because you know you shall heal, you
Yes.
don't have a problem.
Yeah.
But chemo, I think you go in and you're wondering what next.
Yeah.
And you have an idea, but you don't know how it will look like or how it will pan out. So, yeah.
Okay, okay. The question that we are asking you today, even as we're having this conversation, is if you could change one thing about breast cancer treatment, what would it be and why? If you could change one thing about breast cancer treatment approach, what would it be and why? And we've got a bit of feedback on WhatsApp, so let's take a look at that. Our WhatsApp, what are they saying on WhatsApp? Thank you. Hi guys, this is what I understand about the evolving face of cancer treatment. Immunotherapy, this approach leverages the immune system's power to combat cancer, offering a promising alternative to traditional treatments. Immunotherapies like checkpoint inhibitors, CAR-T, yes, thank you, cell therapy, and cancer vaccines have shown remarkable success in treating various types of cancer. Then we have personalized medicine, tailoring treatments to individual patients' unique genetic profiles and tumor characteristics. And this is what you were talking about earlier, Dr. Tracy, is becoming increasingly important. This approach enables healthcare providers to develop targeted therapies that are more effective and have fewer side effects. Thank you so much for that, quite detailed. Hi back, Lorenzo. Okay. Hello. What happens if a breast cancer patient has finished all their chemotherapy sessions and still their immunity is weak? What happens after that? What are the consequences of undergoing the affected breast cancer removal? Breast removal? Will it fix the problem? Will they recover much better? Okay. We probably have you answer that. Hello, what happens if a breast cancer is removed? So we've got two questions that probably we need, we'll probably need to have those answered. Dr. Tracy, I think that one was, hello, what happens if a breast cancer patient has finished all their chemotherapy sessions and still their immunity is weak? What happens after that? What are the consequences of undergoing the affected breast removal? Will it fix the problem? Will they recover much better?
Thank you for the question. I think this is a very pertinent question because even our cancer survivors here has really talked about some of the side effects of the treatments that we give. One of the things that we really try to do is do also a lot of supportive kind of treatments that just help you go through the chemotherapy. So we do have immune boosters. This is available and this is something that we give quite often. If we find that your immunity is still very low, your white blood cells, your neutrophils are quite low, we can actually give you immune boosters. In terms of vomiting, even for hair, I know scalp cooling is something that is coming up quite something new though, but something that is coming up, to just try to see where we can be able to preserve hair so that you don't have total alopecia when we do some of the chemotherapies. So the most important thing is ask your doctor about supportive agents that can help you go through the treatment a bit easier in terms of the side effects of profile of the treatments that we have. In terms of breast removal, maybe I'll take that to Dr. Hungu.
Yeah.
Can help us with that.
Okay, so in terms of removing the cancer or surgery, so when you talk about treatment for breast cancer, she talked about personalizing the treatment, the tumor biology and everything, and also the stage is very important because at what point we catch the cancer will also affect the type of surgery that we can offer. So we talk about it being multidisciplinary, meaning where all the specialties are there, but it's also multimodal. So we have all those different modes that now Dr. Tracy has talked about, and then now we get to surgery. So surgery is one of the mainstays of treatment for breast cancer. The other modes will factor in depending on the tumor biology and the staging. So you might find that not all patients will get radiotherapy, not all patients are candidates for getting endocrine therapy or all those other different types of therapies. But surgery is a mainstay, and whether you start with chemotherapy or you're going for chemotherapy later, we must always remove the area that had the cancer. And then now after that, now we can talk about all the other different approaches that will be appropriate.
Okay, so this comes after that. It's not like we have to talk about them before,
no,
depending
the discussion needs to be had at the beginning. So like if we offer the option of reconstruction, there are those different types of reconstructions. So I can start the conversation, and if a patient is keen on following up with that, then they can continue the conversation with the plastic surgeon.
Okay.
They'll be taken through the different types of reconstructions, what to expect, the aftercare, and all those things. So all these conversations about the different modes of treatment need to be had before we start treatment. If we've done the tumor biology and we find that this patient is a candidate for getting targeted therapy, then we need to start having that conversation even as we are trying to start the therapy. But they need to have all that information at the beginning of treatment.
Okay, okay. I see how important that is. And even as you walk this journey of trying to get better and having all this information at hand, then my question then would be the importance, the role that probably technology has played in terms of just making sure that when you come to reconstructive surgery, then we have the best of the best. And when you talk about the best of the best, are we at par with the rest of the world when it comes to technology and having reconstruction? Elizabeth is busy smiling. I don't know. But yeah, you can start with the doctor.
I think your questions are just spot on.
Yeah.
I'll start with technology. Yes, we do use technology a lot. Like in the gold standard right now in the world in terms of breast reconstruction is what we call a deep inferior epigastric artery perforator flap. A DIEP flap. We'll call it a DIEP flap. And basically, that's the tummy tuck.
Okay.
Let me just call it the tummy tuck.
See now. No flexing, Dr. Sarah. But okay.
So what normally happens is the skin, subcutaneous tissue, and fascia right at the bottom of the abdomen is usually taken out and then reattached to the chest wall and onto the vessels of the chest wall. Okay. So this is the most complex surgery in terms of breast reconstruction, but then it also offers us the best outcomes. So you get an aesthetic donor site, which is the abdomen, because it's flattened, a good contour, very low scar. The umbilicus is also reconstructed.
Yes.
And then you're also able to shape the new breast the way you would like.
Okay.
How technology comes into this, we use imaging to be able to map out these blood vessels. Because you can imagine you're completely detaching a part of the body from the body and reattaching it and ensuring that it survives, that it gets new blood supply and survives and now becomes part of the body. The thing that you like about this autologous reconstruction, so using your body's own tissues, is that it's a lifelong surgery. Yeah. The patient gains weight.
Yeah, because I was going to ask, what happens?
It's part of your body and it continues being part of your body. So if you gain weight, it will the volume would increase. If the patient loses weight, the volume would also go down. So we use that, the CT scan, the imaging, to be able to map out these perforators. Of course, even as the surgery is being done, to ensure that the perfusion is good to the flap, now what we call the flap. We can also use other modalities of imaging, thermal imaging. We can use special kinds of dyes to ensure that the flap is well perfused and will take well.
Okay.
Yeah.
So this conversation of people, they have to do this reconstructive surgery out of this country is a story of the past.
It's a story of the past.
Here and now, to corner evidence. Why were you smiling, Elizabeth, though?
It's being done here, and it's being done in public hospitals.
In public
as well.
hospitals?
So it's not only in private hospitals that it's available, but even in the public hospitals, you can get breast reconstruction services done.
Okay.
Yeah.
She's called Shazad. So the sharp bit of things. Do we go there or just we hold for a moment and get to Munira? Munira, you promised to take us through an exercise and to help us relax and probably understand what it is that you were explaining earlier, like a more practical section. So maybe we can have the seats brought in. Sure. Yes. To the Kitty cha. So you're gonna just do it from there where you are.
That's fine.
Yes. Let's have the seat in. Yes, yes, right there.
We can get our viewers to also join in.
Yes, our viewers as well.
Yes.
Yeah.
Thank you.
So we need to sit.
This is okay. This is good?
Place it right in front of your seat. Right in
there you
front.
go. All right.
Yes.
Okay.
And push it back. Push all the way back. All the way back. Great. So, Dr. Sarah.
Yes.
Kindly help and pull Munira's seat back.
Thanks. I can do that too.
Yes.
Thank
you.
Okay.
There you go.
That's great.
All right. So you'll walk us through this. So for our viewers at home, Munira has taken over.
Okay, so I'm going to start you off with a little bit of breath work.
Okay.
So just deep inhale and exhale, and we'll go through it about 3 times. So just do what I tell you.
Okay.
Just follow me. It's all right.
Do we
Just
sit
relax.
in any particular way? Okay.
Yeah. So we're going to sit a little bit out of our chair. Please don't fall down from your chair. Your back straight, shoulders are soft and relaxed, so you're not bringing them up. Okay. You can be in a receiving mode. So what we say is you're receiving abundance and energy from the universe. Okay. Or this is called Gyan Mudra, but that's okay. Close your eyes and connect to your breath. So taking a deep breath in from your nose and out from your mouth, very slowly and gently. Like you're blowing it out, like you're blowing a candle. We're going to go for the second round. So connect with your breath. When you're breathing in from the nose, you should feel your chest rise. You're connecting to your body. Hold and release from the mouth like a blow. Chest is falling down. Connect to the breath. Observe your thoughts. Take a deep breath in. Hold. And out from the mouth. Shoulders are drawing down and chest falling down. Just being calm. Giving yourself that moment to prepare yourself for a chair yoga session. Saying within, in your mind, you can just say, I am feeling relaxed. I'm feeling calm. All my muscles, my joints, my body is beginning to relax. I'm in the present moment. My mind, my body are in sync. This is my time. I just want to be with me my body, my mind, and my soul. I will do the best my body can do. Taking a deep breath in again. And out. Gently, when you're ready, you can open your eyes. Okay. So that was just a simple breathwork exercise that we went through. And I'll take you through a few chair yoga poses. So this is especially for patients and survivors who are weak at this moment, or who are feeling the soreness and stiffness, are not able to move so much. So it's just very gentle. And I always tell them to listen to their body and do what their body tells them to do, and stop when there is any pain. So just we're going to do simple toe lifts, and maybe you can just do it on your on the chair. So just simply lifting our toe, and whilst you're doing that, you take a deep breath in and out, and again, and again. Toes up and out. All right. We do the same with the knees. With the heels. Lifting it up. Breathing in and out. Heels and out. Heels and out. Okay. So I do about at least 5, 6, or 10 rounds of each. Something simple, you're out of the chair, you can hold the side of your chair, and if you can, and the viewers can, we join our knees, lift our toes, and just, we're going to pull our legs out. Those who can do it, go ahead. Those who can't, not to worry. Basically, this is a hip opener exercise. And when your legs and your ankles are stiff and sore, this is such a nice, soothing, calming exercise for the flow of blood in your body. Simple, right? We do knee taps, very simple. And this is just gaining muscles in your, getting strength in the muscles. So 1, 2, 1, 2. 1, 2, 1, 2. Helping the core as well. 1, 2, 1, 2. All right, we have shoulder rolls for those who have soreness around the chest and the breast side. So 1, 2, and 3. And we can do the same front. 1, 2, and 3. I've heard our ladies here speak about hand movement. And of course, that is also, now you've got a lot of stiffness and soreness. So very simple movements of 1, 2, 3. We can do, if they're able to, is lift. So you go into a cactus position, lift your hands up, breathing in, and pulling a rod down. Again, breathing in, and pulling it down. Breathing in, opening that space in your body, and pulling it down. Of course, I will monitor how many they can do. And it's, even if you can do 1 or 2, it is helping you with the flow, with the muscle. And some simple the back stretch, which is called the cat and cow position. You can even do it on the floor, on the yoga mat. So you take a deep breath in, and take your hands and put them on your knees. So your hands are straight, and you've hunched your back out. All right, you're hunching your back. Your chin is to the chest. You push your back out. Feel that stretch. For those who can do it, yes, feel that stretch. Breathing in, lifting your hands up for those who can, and that's fine if you can't. And put your hands at the back, but lifting your chest out, your neck up, looking up completely, and pushing your back inside. And that's 1, and you let out.
Oh, Munira, that's powerful. It feels amazing.
So these are just a very few simple, very simple, gentle. But you feel that it's called the prana, the energy that's moving in your body right now, and because you've moved.
It feels quiet and calmer.
Yes.
And it's not just inside, because I can feel it inside me, but even with the space here, with all of you, the energy is just calm. And on that very calm energy, we're going to take a quick commercial break. We'll be right back. Don't go too far. Welcome back to Wellness Wednesday. On this beautiful, beautiful Wednesday, we're talking about breast cancer and the science of it, what it looks like when it comes to surgery, and we're also looking at the soul. Putting all these things together for cancer care, this being Breast Cancer Awareness Month. That is where we're focused. And we're not just focused now, because it needs to be a conversation that keeps going on. And I hope you're learning a lot from this conversation. We still have a few more minutes to go, but the question we're asking you today is a very, very simple. We are asking you, if you could change one thing about breast cancer treatment approach, what would it be and why? If you could change one thing about breast cancer treatment approach, what would it be and why? And on Facebook, Kenneth Muturi says, I could change urban treatment to traditional way, and I'm sure that it can help everyone. Pato British Mo says, what I would advocate is public awareness. I have come to realize that most patients prefer hiding it or concealing their status from their family members. And we had a few confessions in studio today. Slight confessions. Concealing their status from their family members and hence suffer in silence until it's too late. And thank God we didn't wait for that. The government should consider providing cancer treatment for free. Thank you, Pato British Mo, for that. Samuel Muteheli says, the process is too tiresome, simplify it. Mukatia Live says, I would like to volunteer on this initiative. And Mamake Alicia Juliet says, give these patients free treatment and show them the care they deserve when it comes with wound healing. That one made even the care, it would make the caregivers work even easy to attend to the patient, especially at home. The treatment is also too expensive. My mom died a hero, stage 4. It's a monster. Pole sana, Mamake Alicia Juliet. Harry says chemotherapy, that's the thing that you would change. Jadida says government to treat cancer for free. Breast cancer treatment should be absolutely free as well. That is Kaisa Nathan. Thank you for that. I have a patient, and indeed it is tiresome and financially pressing. That is Momani Jr. also on Facebook. Andy Wonsofty says changing eating habits, and maybe we can talk about that for a bit before we come to the end of this conversation. Amos Wekesa says offer free medication. I think that's the one that's taking over in the comment section today. And we have a bit of feedback on WhatsApp as well. Let's take a look at WhatsApp. Hello, what happens if a breast cancer is removed? Hello, does someone know how does someone know they're suffering from breast cancer? What are the side effects? Okay. Hi, I had a breast lump removal surgery last year, but now I have really painful pimples around my breast that turn into wounds. I can't bring myself to go back to hospital. I am so scared. So we'll have someone take that question. Let's see from the top. Thank you. Good afternoon. Mine is not so much a question as it is a quick shout out. Thank you, NTV, for hosting such an incredible educational and inspirational session. Shout out to the warriors who went through this disease and came out stronger on the other side. Together we conquer this disease and many others. Nobody fights alone. And a big shout out to all the amazing doctors, healers, and caregivers. I'm with you on that one. Where are those doctors found? Nation, I'm happy to be part of this topic. I am a cancer warrior since 1998 March. I always thank God to have brought me this far. I currently need someone who can tell me where to get breast foam and bras. It's always a challenge when the ones you have are worn out. Thanks once again. I am Jane A. Odhiambo. We'll have that as well. Hello. What happens? I think we have looked at that one. Oh, okay. So for the questions. We've gotten the question around, I had breast surgery, and now I have pimples right there, and I can't bring myself to go back to hospital. What could that be? What does that mean?
Well, not all lumps in the breast are cancerous. So for this lady, we first need to know, we need to know everything. We need to know what's her age, what did the initial test show before she went for the surgery, after the surgery, what did the lab report show what it was, and just basically needs to be checked because we don't have any information
to go by from that. Okay.
Yeah.
Is it a common occurrence for pimples to appear?
So, did she talk about pimples or wounds? I think she said that it keeps opening up in wounds and the nipples are painful, I think. So, yeah. I don't know. We just need to know what surgery, what the lump was, where the siting of that incision was, because depending on where the incision is, there's how it will heal and the associated effects.
Yeah.
So we just...
All right.
Yeah.
All right. Shazad, do you wanted to say something? Or
I think she was saying pimples that had turned into wounds and therefore fluid and leaking out.
So yeah, okay. There was the other question around getting breast foam and bras. So
there are mastectomy bras and breast prostheses, and those ones can be offered by the physiotherapists and occupational therapists in the major hospitals. And also some of the cancer support groups have links where they can get these consumables.
All right. Did I leave out any other question? No, I think that's about it.
You want to know where to find Sarah?
Oh yeah, where are those doctors found? That was very loud, but if you're free to share, I mean, why not?
Yeah, so for me, I'm found in Nairobi. I think the most important thing is that we can share my links and where I can be found on social media, and also my phone number, and they can just call me directly. As a clinical oncologist, I'll be able to assist. I always say just seek care because we don't know what you're fighting, and we're with you in the fight. We always see patients who are emotionally supported, supported with other kind of therapies that we've been taught today. Their outcomes are much better.
Okay. So you'll share that probably at the end of the show?
No problem.
Okay. And the rest of you?
But I think it's important to say that we work in the public hospitals.
Yes.
They work in KU Teaching and Referral, I work in KNH. So all these services are available in our tertiary hospitals.
So there's a question about insurance and reconstructive surgery. Is it covered, or ukitaka hii maneno ingine, you take care of yourself?
Yeah. Lovely question again. So in the public hospitals, what normally happens, because the Social Health Authority covers for flap reconstruction after cancer excision, then we're able to get that coverage through SHA. When it comes to the private hospitals, most of the private insurances do not cover for breast reconstruction. So anything that has been labeled plastic surgery, there's still a very common misconception that plastic is only aesthetic, but there's a huge arm of plastic surgery that is reconstructive, which is actually the majority in Kenya. So part of what we do, we're not only surgeons, we are also trying to influence policy so that we can have extended coverage of these services for our patients. The name plastic is... Plastic comes from the Greek word plastikos, meaning to mold, because that's what we do. We mold, we reconstruct. But there's a little bit of stigma on that name, plastic surgery, but this is just a call to insurance providers, even the Social Health Authority, to just expand that coverage so that all our patients are well taken care of.
Absolutely. Elizabeth, how was it for you? Did you cover it yourself, and was there stigma around, saying I'm getting reconstructive, guys, and a tummy tuck to go with it?
It's very loud.
No. You're on national TV.
Yeah, I know. But what I'm saying is you don't say very loud even when you're going in. But for that, I had to pay from the pocket. But for me, what SHA paid for me was my chemo. Every session I went through, and I went for 16 sessions of chemo. That was covered by SHA. But this other one I had to, it was out of pocket.
Okay, thank you for that. Shazad, you talked about how life changed for you after that, and you take the time now to talk to people. So probably the post of that, you know, going through all of that as you come to the end of this conversation, how is it now for you, and what spaces have you found yourself in terms of sharing these conversations with people, or sharing hope, telling your story as well?
I'm in a very emotionally free space.
Okay.
I'm more free-spirited. I do things that I wanted to do for myself that I never did. I'm still not efficient about finding more time for myself, but I'm getting there.
Yeah.
I do things that I want to do. I don't wait for a companion to go with me. If I wanted to do it and I'll not get company, I'll still go for it.
Yes.
I went for a graduate program with Strathmore last year, and I was so proud of myself that I did it. I wanted to do it 20 years ago.
Yeah.
But it took cancer to make me realize I still need to do it now. So it's a very different space. You have a very different perspective about life. Things don't really bother you that much because you've done so much during the cancer journey that you become much more braver internally. So you're able to actually cope with it. And when people try to hide that you have cancer, you don't have to.
No.
I mean, from the day I started, it was like, oh, Shazad, there's cancer. It's fine. I have cancer and I'm going to deal with it, you know. But, you know, you become very grateful. You talk about, you know, you're talking to yourself and forgiving yourself and thanking yourself and loving yourself because you really missed out on all that.
Yeah.
So you become a very different human being. So it's really a fringe benefit of cancer, actually. So cancer is not all that bad.
Yeah.
It's actually there for a life lesson to get better, to go back to your maker in a different position. So
Yeah.
it's a good journey.
When we started the conversation, well, about more than close to 2 hours ago, I said how this is a very personal journey. It's a personal journey of courage and of healing, and it's different for different people, even with the theme for this year's Awareness Month. How is the journey for you up to where you're at? Where are you? Are you on the same level, but we're still finding the color and the lessons in there?
Like I said, for me, initially, when the doctor told me, I used to go after every 3 weeks for my chemotherapy.
Yeah.
Then now I had to go weekly. And so when we started weekly, I was tired. I was like, no, we can't be doing weekly, really. So all my Wednesdays, even if you try to call me, I'll tell you Wednesday I'm in hospital from 8 a.m. to 5. Then I started realizing when I go into this space where we are having chemo, that there are people actually, for me, like I said, unless I told you I have cancer or I went through cancer, you would not even believe it.
Yeah.
So until maybe you see my nails and everything. So whenever we would be inside there, they would be like, why are you here? You're not looking like one of us. Because some of them would look really sick and they're looking so drained. And so for me, I would either be cheering them. I'm a psychologist by profession. And so I'd be cheering them and clapping for the ones who are starting. It's their first one. So by the end of the day, I'm like, you did it. It was your day one, you did it. The ones who are going home and we wouldn't see them, we're excited about it. So I remember when I was doing my last session, I told them, you must get me a bell. I have not seen anybody ringing a bell here. So bring me a bell because we are starting a tradition where we'll ring the bell. So they brought me the bell. And I brought them cake to just say thank you. So as you go on this journey, I realized that the last day, actually, before they put the drip, there was this girl who she just walked in with her mom. Her mom, both legs looks like they were broken or something. And she was looking very broken. And so I picked up when she was talking and she was, blinking tears. So I told the gentleman who was good putting the drip, wait. So I told her, please come, because I didn't know her name. So I said, what's your name? So she tells me her name. And I told her, I just feel like I need to give you a hug. And I gave her a hug. And she started crying and sobbing. And I was like, what is it? She was like, I don't think my mom will make it. I said, when we all walk in here, we don't know if we will make it. But let me tell you, this is my last one, and they are 16. So she will make it. So like she says, you find there's more to be thankful for. You actually put yourself aside and realize there are others around you who need your help.
Yeah.
I've always been very compassionate, but I think this journey has changed a lot of things.
Yeah.
Yeah, it has.
Okay. And you mentioned that you're a psychologist as well, and I'd want to find out if that space for mental wellness and, we are moving, we are breathing, and we're doing all of that, but talking to someone, understanding this journey, accepting that this is happening and I'm here and now, was that available?
Oh yes, for me I did. I think because I'm a therapist.
So
I would
you
do
knew how
it,
to.
Yes, but I've had now people who are asking, can I come? And
Can I come?
speak to
Oh,
you?
okay.
Because
Okay.
you have gone through the journey, then you understand it better. Because a lot of times when we are out here, we give advice.
Yes.
But you have never walked that journey. So you
Yeah.
give a lot of, like me, I was told, stop sugar, stop. So there's a lot of stop, stop, stop. But they don't know what you're going through or
Yeah.
how your journey was or what kind of, treatment you're going through. So it's important that we actually stop giving advice.
Yeah.
If you've never been through it, with all due respect.
Unsolicited. We hear you, we hear you, we hear you. And we've got about 4 minutes to the end of this conversation, and I'd like probably to get your parting shot. Something that probably we have not mentioned in this conversation that is important to talk about. I know we have not really touched on policies and how closer are we to getting free cancer treatment, if at all. And even as we answer the question of the day, if you can package that in like a minute, and then we'll be out, and then Philip will smile at us. We can start with you, Dr. Eric.
I think for me, my parting shot is that cancer doesn't just affect the individual. I think she mentioned as she was going through her treatment, her husband got a heart attack.
Yeah.
So men actually do bear the brunt of this because they have to be there emotionally to support either their wives, their daughters, their mothers. And it's something that most times we don't think about. So I think they also just need to be included in those conversations.
Absolutely. Okay, okay. Dr. Sarah.
Yeah, just thank you for the opportunity. It was so lovely also to hear what our patients go through, just to have that in mind as we are treating them. Early detection saves lives, get screened. And maybe the thing that I would like to have changed about breast cancer treatment in Kenya is getting all patients offered the breast reconstruction.
Great. Dr. Tracy.
Thank you very much, Mikali, for having me. It was a very wonderful conversation. For me, definitely, it's just making cancer treatment accessible and affordable. This is key because most of our patients can't afford the treatments we offer or even don't even know where to start. I think also the referral pathways have to be a bit more clearer to the patients on where to go and to be offered everything that can be necessarily offered, and then they can be able to choose. What I've learned today is that cancer is deeply human. We see it from a point of view that it's just a disease, but it's deeply human. We need to treat our patients with more dignity, offer them more hope, and also offer a lot of supportive care.
Thank you so much. Munira, I know we didn't get around to EFT and...
It's okay.
Yeah.
It's okay. Thank you so much for having me on the show. And I would like to say that please, for those who are able to and can, do include supportive therapies in this journey of yours.
Absolutely.
I know it's not easy, it's a difficult one, but there is hope. There is hope, and we want you to go through this with dignity, pride, and perseverance, and every step, every breath, every moment, every move you make with that hope and with that feeling, you are making your way. You are making your way. So there are so many. It's not only EFT and chair yoga.
Yes.
We have sound healing. We have Tai Chi.
Oh, wow.
We have meditations, and we are really trying hard to include this. Include this in the journey, and hopefully through AKU we are trying to do that. But if not, there are practitioners available out there. Connect to them and take some me time out. Just take that time out, and get into that. Get ready to have your emotional stability and balance, so that you don't have so much stress.
Okay.
As it is you're dealing with it, but this will help you a lot. Yeah.
All right. How can people get in touch with you? And we will ask the same. I have about a minute.
Yes.
So
we can share our email contacts and numbers with you. Yeah.
Okay.
All right.
No problem.
Okay.
Same as the rest.
Yeah.
Okay.
Thank you.
Great. Shazad.
Just lead a wholesome life.
Yeah.
A normal life. There's nothing wrong with anything that happens. You deal with it, you flow with it, you continue with it, and life moves on.
Absolutely. Thank you so much.
Just be that.
Such a beautiful spirit. Elizabeth, Sujikama, is the mic back on? Philip?
It was off.
Oh yeah, we're good. So your final parting shot, yes.
So for my parting shot is just thank you for this conversation.
Yeah.
I think a lot of times when you're going through this journey, sometimes, of course, you see others, but now when we had a one-on-one with each other, it was amazing. And also saying thank you to the doctors. Not everybody is mean and nasty. When you get a good doctor, run with them, because half of these things were done here.
Okay.
And you don't have to travel away. So it's possible to do everything here.
Thank you. Thank you, all of you. Thank you, Dr. Eric, Dr. Sarah, Dr. Tracy, Munira, Shazad, and Elizabeth. Asanteni sana for your vulnerability, for your vulnerability, and also for your wisdom as well. Thank you, guys. That is all we had for you on this amazing Wellness Wednesday. We'll see you tomorrow, same time, same place. This has been Your World. I've been your host, Mikali Mary. Have a beautiful day. Adios.